Hello, Dr. Dayanayev here from Steinway Family Dental Center. We get a lot of questions about dental x-rays. So today we're going to answer some of the most common questions about dental x-rays. The first question is, what is a dental x-ray? Well, the x-ray is basically the rays that penetrate through your skin and find the bony structure, and then there is a reflection of all of that on the sensor or on the screen. Something that we cannot see with naked eye, that we can see inside of bone and so on. The next question is, when do dentists take x-rays? Well, dentists take x-rays whenever they're doing your examination. So once every 3 years is a standard to get a full set of x-rays, or once every 6 months it is standard to get partial set of x-rays. Also, if somebody is coming in pain and we need to see what's wrong with them, we also take x-rays. But I think that is pretty clear. Usually people have more questions about how often they should take the x-rays and what type and is it safe or not. So that's the different types of x-rays. Next question is, what is the purpose of dental x-ray? Well, of course, it's diagnosis, right? So the more information we have about you or your mouth, the better we can diagnose, and we want correct diagnosis for it. Therefore, some things are not possible to see with the naked eye. We can look at you and you maybe are looking pretty, but when you open your mouth, we can see that some teeth are broken, or we can see that there is a small cavity in it. But how deep it goes, it's not possible to predict yet, right? The tooth is not broken in half yet. So we would take an x-ray and that will show us the extent of the decay. What are the different types of dental x-rays and how are they used? Depending on the purpose or what are we diagnosing, right? What is the problem that the patient has? It could be a small x-ray. That small x-ray will be showing your teeth, either the teeth coming together and it shows both of the teeth, the coronal aspect of it, or it can show the entire tooth with the root and with the bone around that root. That is one type of x-rays. It's called periapical. Peri means around, apical means the apexes of the root of the tooth. There also could be called a bite wing. Those are the x-rays that they ask you to bite on, and it shows top and the bottom teeth on the same image. The bite wings are the ones that you can see the cavities on. When it's a periapical, when the entire tooth is shown, we can see the roots and see if there is a cyst growing on the end of the tooth, or if there is in the bone there is some kind of formation. Now the surgeons like to use panoramic x-ray. The panoramic x-ray is the x-ray that goes around your head, and you can see most of the teeth that the patient has, including with the jawbone. So that is the x-ray for that. There's also a temporomandibular joint x-ray, the x-ray that shows your side, and it shows the relationship between the lower and the upper jaw and how do they meet at the joint here. The next x-ray that we have is called cephalometric. Usually the orthodontists take that. That is a side view of your face and basically a profile x-ray, the entire profile. And that also shows the relationship between the upper and the lower jaw and how it relates to the entire skull. There's also three-dimensional x-rays. This is three-dimensional x-rays that could be used like a CAT scan, right? Slices of the x-rays, different increments, and could be very small increments or larger increments. And those are used to see where the bone is and how wide the bone is. If you're looking to get implant placement, you want enough bone on either side of the implant, so you have to select correct size of the implant, right? It depends on the amount of bone that you have in that area. So those are the different types of x-rays. I hope that's been helpful. The next question is, are dental x-rays safe? The truth is dental x-rays are very, very safe. Even though you may say that, oh, you're taking this 18 or 20 x-rays, there's a lot of them, and there's a lot of radiation, and I don't want to do that. I don't want to be exposed to radiation. The truth is that full set of x-rays today, because of the sensitivity of the x-ray sensors that we have, it is equivalent of you sitting under the sun for about 10 minutes. So you get the same amount of radiation if you're just tanning for 10 minutes or just sitting outside and walking under the sun, or you would get a full set of x-rays and just the same thing. So it is very, very safe. The next question is, can dental x-rays show periodontal disease? Perio means around, dental is tooth, right? Can we see the bone around the teeth? Yes, right? The X-ray would show that. Therefore, we can tell if the patient has lost a lot of bone and has periodontal disease. That may not be enough, but it would be a start. The next question is, are dental X-rays covered by insurance? And it is pretty standard, even though we all know that the insurance company would like not to spend any money, but they have to spend money on diagnostic stuff. Most insurance companies have diagnostics covered, which means all the X-rays that you need would be covered. They're not gonna get you sets of X-rays. For example, you need a full set of X-rays. They would do it once every 3 years because those are the standard of treatment, right? They would give you once every 3 years, but if you have smaller set, like every 6 months, they would cover less X-rays than in a full set, but they would cover them. So yes, and if you're just in pain, don't worry about it, go see your dentist, it would be covered. I hope that's all the questions that you had. If you have some questions that I did not answer, then maybe you can ask them in person. So you're welcome to schedule an appointment with me, come in. You can call us at 718-728-3314 and you can either see me or one of the other doctors here, and we would answer all your questions and see, particularly in your case, what kind of problems you have and what does your X-ray show. And we will teach you even how to read them. And if you can't call us, then you can find us on alldentalneeds.com and request an appointment, and somebody will get back to you and we'll schedule your appointment so we can answer all your questions.